Hello guys, welcome back to my channel Anytime Medicine, and today we are going to talk about is clinical application for pyrimidine metabolism. Like we have seen in my previous video, pyrimidine synthesis, especially for making of UMP, we have divided into three steps. The first step is to make carbamyl phosphate from glutamine with the help of carbamyl synthetase 2. So the second step is to make orotic acid. We can make orotic acid from carbamyl phosphate with the help of aspartate. So the last third step is to make UMP from uridine monophosphate from orotic acid and PRPP. PRPP is phosphoribosal pyrophosphate with the help of UMP synthase. If we don't have enough UMP synthase, we will get orotic aciduria that we will talk about in next slide. So orotic acid is an autosomal recessive disease. There is defect in UMP synthase enzyme, and that will lead to increased amount of orotic acid in plasma. So there will be orotic acid in urine too, because we have lots of orotic acid in plasma. There is also loss of pyrimidines because we don't have UMP synthase enzyme, so we cannot make UMP and therefore uracil. That's why there will be megaloblastic anemia because of no response to folate or vitamin B12 to pyrimidines. We can also see growth retardation in children too in orotic aciduria. We can treat this with uridine that will bypass the UMP synthase and will provide the direct source of uridine. But we still have orotic acid in urine as we just have bypassed the pathway, but we can reduce the symptoms like megaloblastic anemia. So the other disease we are going to see is orthinine transcarbamytase deficiency, which is OTC deficiency. This is a key enzyme for urea cycle that we are going to talk about in my future videos. This enzyme combines carbamyl phosphate and orthinine and will make citrulline. You can see the reaction of carbamyl phosphate and orthinine reacting and making citrulline with the help of orthinine transcarbamytase. So if there is OTC deficiency, we will have increased amount of carbamyl phosphate, and that carbamyl phosphate will convert into orotic acid, and that is the reason we can see orotic acid in urine in OTC deficiency. So lots of people get confused with these two, orotic aciduria and OTC deficiency. So do not get confused with these two, orotic aciduria and OTC deficiency. We can see orotic aciduria in both disorder and can only see high ammonia level in OTC deficiency because of the urea cycle dysfunction that we are going to see in my future videos of ammonia. So keep in mind that both have defects in different enzymes. Like we have seen in my previous video in making of cytidine monophosphate, we can make cytidine monophosphate from uridine monophosphate. Uridine monophosphate will undergo phosphorylation and make uridine triphosphate, and from uridine triphosphate we have to remove one oxygen group and have to add one nitrogen group, and that will give cytidine monophosphate. You can see the structure of cytidine monophosphate down below, and that cytidine monophosphate will undergo again phosphorylation and make cytidine triphosphate, and that will deoxidize and make DCTP, and that will contribute itself in making of DNA. The drug we are going to talk about is ARA-C and is a chemotherapeutic agent, and that will convert it into ARA-CTP. You can see the structure of ARA-CTP, and that mimics the structure of DCTP. You can see the structure of DCTP. In ARA-CTP you can see in ring there is two carboxyl group, and DCTP you can see in ring there is only one carboxyl group, and that will replace its place with the pyrimidines, and that will inhibit the DNA polymerase and will lead to inhibition of proliferative cancer cells. So in my last video we have talked about synthesis of thymidine. We have divided synthesis of thymidine in three steps. The first step is to convert UMP into DUDP. We can make DUDP from uridine monophosphate, and that uridine monophosphate will undergo phosphorylation and make uridine diphosphate, and that uridine diphosphate will convert into DUDP with the help of ribonucleotide reductase. If we don't have enough ribonucleotide reductase, we cannot make DUDP. We are going to see some medication that is related to ribonucleotide reductase. The drug that inhibits the activity of ribonucleotide reductase is hydroxyurea. This blocks the formation of deoxyuridine, which is the deoxynucleotide. Usually RNA will remain intact because of this blocking process is only for thymidine. So thymidine we cannot use in RNA, so RNA will remain intact. This is usually used for malignancy and can also used in polycythemia vera and essential thrombocytopenia. This can also used in sickle cell anemia and causes the increased fetal hemoglobin level, but this mechanism is unclear. So further, if we talk about thymidine synthesis, the second step is to convert DUDP into DUMP by removing one phosphate group. That process is called dephosphorylation. And the third step is to convert DUMP into DTMP. We can make DTMP from DUMP by thymidylate synthase and N5N10 tetrahydrofolate. N5N10 tetrahydrofolate is a one carbon source for DTMP. So the drug 5-fluorouracil is a chemotherapeutic agent and that mimics the uracil. You can see the structure of 5-fluorouracil that mimicking the uracil structure. That 5-fluorouracil metabolizes into 5-DUMP, which is abnormal DUMP, and that will covalently bind to N5N10 tetrahydrofolate and thymidylate synthase, and that will result as inhibition of thymidylate synthase enzyme, and so we cannot make DTMP, and that will block the DTMP synthesis. As a result, cancer will die without thymidine. Like we have seen in my previous video for folate, how we can make N5N10 tetrahydrofolate and activity of dihydrofolate reductase activity. Today we are going to see medication that related to these compounds and enzyme. So the drug we are going to see is Methotraxate, which is chemotherapeutic agent and also an immunosuppressant that mimics the structure of DHF. You can see the structure of Methotraxate on your right and the structure of DHF on your left. That will also inhibit the dihydrofolate reductase activity and blocks the synthesis of DTMP, because dihydrofolate reductase convert folate into tetrahydrofolate, and that tetrahydrofolate will convert into N5N10 tetrahydrofolate, and that N5N10 tetrahydrofolate will contribute itself into making of thymidine. So note that we can rescue the blocking process through leucovorin, which is folinic acid, and that will convert it into THF. Because of this leucovorin converted directly into THF, we can use in bone marrow suppression by bypassing the pathway. Now we are going to see sulfonamide antibiotics. In order to understand mechanism of action of this particular drug, we have to first understand synthesis of tetrahydrofolate in bacteria. In bacteria, tetrahydrofolate comes from PABA. PABA will convert into dihydrophthoric acid with the help of dihydrophthorate synthase. This enzyme will inhibit bisulfonamides. Dihydrophthoric acid will convert into dihydrofolic acid, and dihydrofolic acid will convert into tetrahydrofolate with the enzyme dihydrofolate reductase. This enzyme will inhibit by trimethoprim. Tetrahydrofolate will contribute itself into DNA making. So bacteria cannot absorb chlorinic acid. They synthesize tetrahydrofolate from PABA, which is para-aminobenzoic acid. Sulfonamide mimics PABA, and that will block the synthesis of tetrahydrofolate in bacteria. Decreased THF will have decreased DTMP and will lose the synthesis of DNA. This drug will have no effect on human cell because we cannot make folate from PABA. We take folate from diet. So last we are going to see is folate deficiency. If we have folate deficiency, then we will have loss of DTMP production and will lead to decreased DNA production, and RNA production will relatively be intact because folate it contributes itself in making of thymidine, and thymidine only used in DNA. We can have macrocytic anemia too if we have folate deficiency. Women who are pregnant and have folate deficiency, their children would most probably have high risk for neural tube defects. Thank you everyone for watching this video. Do subscribe my channel, share it to your friends, and see you until my next.